Okay, so this was a systematic review, a meta-analysis where they pooled data from multiple similar studies to figure out what's the overall effect. There were 12 studies looking at over 7,500 patients with MS. And what they wanted to know was how prevalent is anxiety and depression? And if you look at these dates, it went from 2015 to 2021. So it did capture a part of the pandemic, which we know caused anxiety and depression and stress to go through the roof. So roughly, it's about 1 in 3 people with MS are dealing with anxiety or depression, or even both. These conditions tend to co-occur. And so it wouldn't be unusual for people who experience anxiety to also experience low mood. So it's common. And I actually feel like these numbers are even higher based on what I see in my interactions with patients. Very, very common. And there's many reasons for this, from just our busy lives to too many demands to our health conditions. This is going to help us kind of get a better understanding of how we think through mental health issues from a conventional medicine perspective. So certainly genetics play a role. Many of us have a family history of family members who've had anxiety and depression. We tend to explain depression as maybe a deficiency of serotonin, and a lot of our drugs increase serotonin levels, for example. Medical conditions like heart disease, liver disease, kidney disease can lead to depression and anxiety as well. So can problems with hormones like an underactive thyroid. Nutrients like B12 are really important. So if you are being followed by your primary doctor or psychiatrist, they may very likely have checked a vitamin B12 level on you. It's not the only one. There are many others, but that's a very common one it's like low-hanging fruit. And then substance abuse, from alcohol to other drugs, can certainly impact mood. So can trauma. And I'm talking about either physical trauma, like getting into a car accident and having all of the aftermath of that, as well as emotional trauma. We know that people who have had significant trauma experiences, especially in childhood, tend to have higher rates of anxiety and depression as adults. And the reason I'm giving you this list is because I want you to reflect back about what might be some of the reasons for you, because that actually gives us a clue as to what might be helpful in improving your mood. So I want to build on my conventional medicine thinking and expand upon some other things that perhaps conventional medicine doesn't fully explore. So functional medicine is a very holistic system of medicine where we look at the body in terms of different functions, rather than chopping up the body into organs and giving each organ to a specialist as we do in Western medicine. So in functional medicine, we think about everything on the left-hand side, but we also place a lot of importance on stress and what it does to the body as a result. Poor nutrition, disrupted sleep and insomnia, sedentary lifestyle, toxic exposures. And then if we kind of dig into some body systems, when you think about the immune system dysfunctioning, as many of us have figured out how to do with our autoimmune diseases, diagnoses, people who experience autoimmunity, inflammation, if you have a diagnosis with an itis at the end, you're more likely to experience anxiety and depression. And here's one we don't think about often: allergies. People who are allergic, there might be histamine release. When you release histamine, your blood pressure can fall, and as a result, your heart rate can go up, and that can feel like anxiety. So it's important to kind of do an assessment of a person from head to toe to try to understand what are the underlying causes of mental health issues. I would add to that, if your gut microbiome is disrupted for any reason, antibiotics, trauma, stress, poor, nutrition, if those good bugs aren't present in your gut microbiome in the relative amounts we want to see them, that can also contribute to mental health issues, as can dysfunctional mitochondria. Mitochondria are the parts of your cell that produce energy for you. And when we don't put out enough energy, we get a lot of different symptoms like mood disorders, anxiety, depression, fatigue, muscle pain, arrhythmias, chest pain. So what I'm trying to drive home here is that anxiety and depression are complex. Rarely is there one cause. And if these are diagnoses that you're dealing with, they're multifactorial. They're probably hitting on multiple bullet points from both sides of this slide. Now, what I don't want you to take away from this slide is that you have to attack each bullet point separately. The approach I'm going to talk to you about is going to address all these bullet points, except maybe the genetics part, simultaneously, because we're going for root cause improvements. We're going to attack mental health at the root cause level. So here's an interesting study here. This basically looked into the relationship between depression and MS. And what they actually concluded was that oftentimes depression precedes your diagnosis of multiple sclerosis. So we aren't getting depressed because we have a diagnosis we don't like, and we're reacting to the diagnosis and becoming depressed. Actually, depression can precede the diagnosis of multiple sclerosis by quite a few years, if not more. And what they concluded was that when there's increased inflammation in the body, and there are these cytokines, which are communication molecules of the immune system, and these inflammatory molecules reach the brain, among many other things, like MS, they can cause anxiety and depression. Anhedonia is a word that basically means that you are no longer able to find joy in the things that previously you were interested in. It's a really common symptom of depression. Also, because these cytokines that are inflammatory reach the brain, you can also have sleep problems and fatigue. So it's rare that people have anxiety in isolation or just depression in isolation. They oftentimes have low energy, disrupted sleep, mood is off. So it's kind of a big soup all mixed up together usually. So let's start by talking about stress and mental health. We know stress wreaks havoc on the body. It puts the immune system and the nervous system on high alert. It stresses the hormonal system. It causes your gut health to go out of balance. And there is a very strong correlation between stress and anxiety and depression. And so this is an opportunity. If we can better manage stress, we can make anxiety and depression better. And there are lots of ways that stress management techniques can be helpful. So this is a study actually out of my group where I work at Stanford. They basically took various different short breathing exercises and compared it to mindfulness meditation. And what they found was just a brief 5-minute exercise of breathing, where especially if you were to lengthen the exhalation portion of your breathing cycle, it actually did even better than mindfulness meditation, right? So I'm not saying mindfulness meditation is not important, because it is a wonderful tool and it really can be an important therapy for anxiety and depression. But even a 5-minute breathing exercise can have profound effects on a lot of these hyperarousal symptoms that go with anxiety. And also it was able to help lift mood up. Here's another study where they did an 8-week intervention where every day the group had to meditate for 13 minutes. And what they found was at the end of the 8-week period, people had better mood, they had better brain function, so they had better attention, they could basically get through tasks better, anxiety was better compared to controls. So while even a 5-minute breathing meditation can help ease the symptoms of anxiety and depression, if you can commit to 8 weeks, something a little bit more long-term where it really starts becoming a habit, it really starts turning things around. So this is a tool that's actually really powerful. Hypnosis is also very effective. And hypnosis isn't always easy to access because it can be expensive. It's not always covered by insurance, although it can be. there was a meta-analysis, again, taking many studies looking at hypnosis and anxiety. And what they found was that people who did an intervention of hypnosis, it reduced their anxiety by almost 80% compared to controls. That's a lot. We don't even have medications that can work that well. And the other interesting finding was that when hypnosis was combined with other psychological interventions, maybe it was cognitive behavioral therapy, maybe it was medications, that it worked even better. So if you are not able to access hypnosis, there is a wonderful self-hypnosis app called Reverie, Reveri. It's developed by Dr. David Spiegel, who is the medical director of our clinic at Stanford. And it really just makes self-hypnosis very accessible. And you can listen to the different exercises and do self-hypnosis on yourself and see how it goes. So again, it's another tool. So when I asked you to come up with 2 or 3 things that you're going to walk away with today, perhaps you look into what, a breathing exercise, a longer program, or self-hypnosis. And so stress management just has to be a part of our strategy for better mental health. So I always talk to my patients about removing any stressors that are removable. And I challenge you, maybe by the end of today, to come up with 2 or 3 stressors in your life that you can easily remove. It could be a commitment that you're kind of tired of, that you don't really look forward to. It could be some ritual or something you do that's unnecessary, right? It could be just decluttering your house to make things easier, right? Like, what are 3 things you could do to immediately declutter your life and your mind? And for all the other leftover stress, it's important to build coping strategies. And this can come in many forms. I don't want you to think that all there is mindfulness and meditation, and you have to sit there for 45 minutes in silence. Truthfully, I think that's not possible for most people, myself included. Some of us need to move. Some of us need to be more active when we are getting into a more calm state. So perhaps you can engage in various breathing exercises. There are lots of different apps online, like the Calm app or the Insight Timer app, where you can find lots of mindfulness exercises, lots of breathing exercises. This is my personal favorite. Exercise is my meditation. And anytime you move your body, you start integrating the body with the mind. You sort of become one whole being, rather than this entity where the mind is kind of where you spend most of your time and the body's just kind of forgotten. So when you exercise, you actually bring the body into the equation. And I know some of you are very good about your exercise, and it is probably one of the main things that's contributed to your ability to live well with MS. So any kind of exercise. I mean, it could be Qigong or Tai Chi, some of these Eastern exercises. It could be yoga. I love this website called Yoga with Adrienne. You can go on YouTube and find her. It's free, it's accessible. You could do very simple yoga that is going to be in line with your particular ability level. We all come here with different levels of physical ability. So finding what feels good is really important. For those of you that have a religious practice, prayer can count as your meditation if you're really being very intentional about using it that way. And I'd also put a hobby in there. Have any of you ever engaged in something you love, like knitting or painting or working on your car, and you just get lost? Right? You're in flow, you've lost all sense of time, and you are immersed. I would give you credit for that as well as a stress management technique. But you've got to build time to do these things. And you deserve to have time to do these things, because this is self-care, and it's such an important component of MS care. So, and I forgot to say, time with loved ones or pets. And that's why I put that picture there. Anytime you cuddle with something you care about, it could even be a tree, you release beneficial hormones, right? And your immune system loves that. So spending more time in things that bring you joy. It's So just make sure you schedule it and you are paying attention to this. I started with stress management because I think it's the most important. If you ask most people with MS about trauma, you'll come away with learning that a great majority of them have had lots and lots of stress. And there's a personality trait that goes with people who develop autoimmunity. So now not everybody fits into it, but the topic for another discussion another time.